Trinidad and Tobago. As we jump right into it this morning, where Health Minister Terrence Deyalsingh, he actually admitted that some drugs being distributed through the Chronic Disease Assistance Plan, which of course is CDAP, may be substandard. And he said that he's been getting many reports from the media and the public that drugs being given to treat diabetes and hypertension were not working. So we should have on the line Andrew Rahaman. Good morning to you, the president of the Pharmacy Board of Trinidad and Tobago. Good morning.
Good morning.
Glad to have you with this morning, Mr. Rahaman. Tell me, is there any truth to what the minister is saying? He said that he needs to do some more research so that he can actually get evidence that this is a fact. What is exactly going on with respect to the drugs, especially related to hypertension and diabetes, the CDAP drugs?
Well, the minister did say that there was always a type of anecdotal complaint about the efficiency of those drugs. And he mentioned, it is either PAHO or WHO.
Yeah, PAHO.
Right. And so it seems as though the evidence is there now. That it wasn't there, it was just based on complaints. And it seems to me as the evidence is there. But from the outset, I wanted to widen the conversation a bit because the information I have, there's no separate procurement system for CDAP drugs. C40, which is the institution through NIPDEC that procures the pharmaceuticals for CDAP, simultaneously procures the drugs for the government sector.
Okay.
And there is no distinction in the one supply of drugs for a particular ailment is sourced and procured, and that supply of drugs is shared between CDAP and the government sector.
Okay.
So I think it is a wider conversation that needs to occur because it is the same drugs, that is my information, the same drug that finds its way into the public health sector. Because when we see the ads also for NIPDEC tender process, it is an ad for pharmaceuticals and non-pharmaceuticals.
Okay.
There is no tendering process separately for CDAP pharmaceuticals. There is tendering for pharmaceuticals at C40. And from that supply, some will be allocated to CDAP and some will be allocated to the government dispensaries and hospitals. So there is a case to be made for the fact that it is not only the drugs in CDAP that are bad.
Okay, now he said... Go ahead, finish.
The drugs in the government sector
also
will also be because it is the same supply.
Now, the minister also said that that the drugs in question were actually received from Indian suppliers and were not produced for international sale. That was what the findings were. How is the procurement of these drugs done? Who decides? You said NIPDEC does the process, but how are the drugs? Okay, you say we'll choose this over that. How is that done? Do you have any idea?
Well, it is supposed to be sourced from drugs that would have been approved by the Ministry of Health, Chemistry, Food and Drug Division.
Okay.
So it is a bit difficult. Well, one hand seems to be clapping in that regard because there are supposed to be no use of the drugs that are not approved by the Chemistry, Food and Drugs in the ministry. But one component of that approval is usually missing because there is also supposed to be testing of the drug prior to and subsequent to approval. But there is a problem with the lab in Trinidad, and I suspect that is why PAHO was utilized in relation to getting some more evidence of the efficiency or lack thereof of the drug. So it is a little difficult to see how drugs would have been procured, which are not, if they were not approved by the Chemistry, Food and Drugs, because they are two arms of the government sector.
Okay. So basically they would be the ones to do the testing, do the process and everything before certain drugs were identified for CDAP use. And these, of course, would be the more generic drugs, as it is called.
Well, for all drugs, and I want to take out the word testing from what you said, because there's a problem with the lab. and it's been operational.
Okay.
And even when the lab is operational, we don't have the expertise, as far as I am aware, to test the medication. So it will really go on a process for registration. And I don't want to limit the process to drugs to CDAP or drugs to the government sector, or limit the process to drugs, to generic drugs. It is a carte blanche registration process of drugs in Trinidad and Tobago that the Chemistry, Food and Drug Division is responsible for.
But if that
there
is
is a problem. Mm-hmm.
If that is the case, and you say that there is a problem, then what does that say about the quality of drugs that we're getting into Trinidad and Tobago overall?
Well, the problem really rears its head correctly, as you said, in relation to generics. While the process is not for generics only, there's this possibility, this distinct possibility of counterfeit drugs or substandard drugs entering, mainly because of the emergence of generic drugs. And there is a process in place, yes, in the government sector through the Chemistry, Food and Drug Division. But one of the things that is supposed to seal the process a little better would be the testing of the drugs. And there's always this question about the quality, because there's not proof beyond doubt based on testing of the actual product. And also, even when there was testing to the extent of the capabilities of that lab, there is no post-market testing. So someone might well submit the authentic thing for the registration process where they're supposed to be tested.
Mm-hmm.
And subsequent to that, when supplies are brought into the country, I know in some of the developed countries there is a random removal from shelves and testing after to prove that the supply continues to be authentic. So there are many questions and many inefficiencies of that system.
So in a case like that then, does that mean that apart from what is given as a sample to be tested, as you say, that needs to be a continuous process when the majority of the drugs come into the country to ensure
Yes,
the safety and health of our citizens?
And on a continuous basis. 1 year after, 2 years after, on a continuous basis, there must be that diligence in continuing to prove that the drugs that reach the citizens are the authentic drugs.
Now, the drugs that are in question here, the drugs from India that the minister pointed out for hypertension and diabetes, have they been, do you know, well, you should know, whether there's been anything to remove them from the program or take them off the shelves or anything like that?
Not as yet. Well, you rightly use the correct word. We should know. There's a difficulty also with the consultation process, where we don't have the type of, well, or any consultation when these issues arise. And when the remedial action happens, there's no consultation either.
So you have no idea when this will take place, if at all, and what the drugs are?
No. But we don't even have an idea of what was done, okay, or what was the level of proof, what POW did or when POW started its work. We have no idea about that conclusion, what informed the conclusions. We expect it to be testing of the products, but we have not been given any information of that.
So in the meantime, what's been happening? Business as usual?
Yes, well, once the drugs are, well, since the statement wasn't too long ago, we have not been informed, well, at least for us to disseminate, if we can disseminate the information as to what would be the steps or what are the steps to be taken immediately. What were the offending drugs? Because when there is about, I think there are quite a few drugs on the CDAP program for diabetes and quite a few for hypertension, at least 3 each, I think. So we were not informed which were the offending ones. And then there are times when the supply has to be, new supplies has to be obtained that we get different brands, different generic brands of a particular pharmaceutical for diabetes or for hypertension. That would be on the CDAP program. So we will not have any idea whatsoever as to what is the offending drug, because not only there are more than one medication on the CDAP program for diabetes, each particular one comes by many different brand names on any given time.
Now, what has been the response with the public, especially those on the CDAP program coming in for drugs, for pharmaceuticals, I should say, for hypertension and for diabetes? Have they been a little bit, uncertain as to whether they should buy these drugs? And then have you, as the head of the pharmacy board, basically got reports from other pharmacists saying that they're coming back to saying that's not working as well as it should? Have you had those reports?
Well, the reports were persistent over a period of time. These reports are not new. It is just that we have been imploring the patients to test their sugar level, test their the hypertension subsequent to taking it, and bring the readings to us. Yeah. So that would have been one of the methods of proof that we would have had. So the reports, I suspect, may well be worse now, or may well be more because of the statement of the minister. Mm-hmm. The problem is that in many instances, some of the medications, some are expensive. Now, the diabetic ones and the hypertensive ones on CDAP are not usually expensive, but some people have switched to buying it. But there are quite a few persons that, I suppose, insist on getting it from the government sector, through CDAP or in the hospital dispensaries. And they are complaining. There may be some that might stop it and not buy any to continue the process of the treatment.
All right. Thank you so much, President of the Pharmacy Board of Trinidad and Tobago, Andrew Rahaman, for letting us know what the situation is, and hopefully you're going to find out exactly what those pharmaceuticals are so they can actually take it from the shelves and ensure the health and safety of the citizens of Trinidad and Tobago. Thank you for speaking with us this morning.
Okay, thank you for having me.
Okay.